York to our Bloomberg to our Bloomberg television and radio audiences worldwide. Welcome to Balance of Power, where the world of politics meets the world of business. I'm David Westin. Well, we are waiting right now for President Trump, who's going to make some remarks from the Rose Garden at the White House about initiatives to find a vaccine. But in the meantime, we have economic numbers out today that are a really big story in and of themselves, and we see the markets reacting, although perhaps not quite as much as you'd think, given how dismal these numbers are, whether it's retail sales, industrial production, or consumer sentiment. And to take us through that, we're joined now by Michael McKee. He is Bloomberg economics and policy correspondent. Thank you, Mike, for being here. As I say, the numbers are pretty bad, whether they're a little better or a little worse than what people expected.
Yeah, David, you know the old saying in the markets, sell the rumor, sell the fact. That's what we're doing today. Everybody knew that these were going to be awful. It was really only a question of how bad the numbers would be, and they are as bad as we thought they would be. Americans spent the month of April indoors, not going to stores that weren't open anyway, and retail sales were down on the month by over 13%. That is a new record, 16.4%. That's the most on record, put it that way. Of the 13 categories, only one was up, and that was internet shopping. What we bought, we did buy online. Even grocery store sales, this surprised me, down 12% on the month. I guess we're still eating the mac and cheese we bought back in March. The control group, leave out food, cars, gasoline, building materials, that was down 15.3%, and that is also a record. That's the part that goes into GDP. In this case, doesn't go into GDP. Not the only data out today, more numbers that won't mean a whole lot. Industrial production down 11%, manufacturing production down 13.7%, and that was the worst number in the history of the index going back to 1919. Two bits of good news. Empire Manufacturing improved to negative 48.5 from negative 78.2. I guess that's improvement. And then the Michigan sentiment number, here's the funny one, David. It goes up to 73.7 from 71.8. The current conditions index rises. Everybody scratches their head, but the folks at the University of Michigan say it's because during the month people started getting those checks, the $1,200 checks the CARE Act provided for, and that made them feel a little bit better about themselves.
Well, and that's the question, Mike. The question is, when is this over, basically, right? And is that more a matter of the unemployment, or will these checks, these massive amounts of checks coming from the government, really at some point start to pick up things like retail sales?
It's probably not going to pick them up really quickly, because a lot of categories that are in retail sales aren't things that are going to respond as fast. I mean, gasoline is big. Retail sales are calculated on a dollar value. Gasoline prices are down. They've risen a little bit this month, but they're down, so that's not going to go anywhere. And how much shopping are people going to do? How many restaurants are they going to visit right away? Those are the questions. It's going to take a while for spending to come back, and so it's probably going to be sometime June or July before you even see things bottoming out. The numbers are going to be bad for a while. We just have to get used to that.
Yeah, and we look to China, frankly, to maybe give us some guidance. We had some numbers out of China that were not necessarily encouraging, which indicated that industrial production is coming up nicely on the supply side, but the demand side, the retail sales weren't bouncing back very fast.
Yeah, one of the first things the Chinese did was put their factory workers back on the assembly lines, and they started building stuff again, which meant that industrial production rose by 3.9% on the month, which would be good news, except they're building things that nobody's buying, because retail sales were down by 7% at this point, down 3.3%, and retail sales off significantly during the month. So at this point, if that's a model for where we're going, it's not going to make people very happy.
At the same time, it'll take a month or so, but some states are starting to come back. I mean, we see it across the country. It varies state to state. That may mean that May we won't see much, but perhaps in June we might actually see whether some of the opening up has an effect.
Yes, in some of the categories we may see that. You might see, say, home improvement, things like that. We did see a little bit of a rise in gardening stores. We've seen them open up in Florida and some other places. Even Michigan said you can go out and garden. So those are going to be, to stretch that metaphor, the green shoots of the recovery. It'll take a while before we get there, but we may see some change.
Well, that's the key issue, isn't it? It'll take a while before we get there, because we heard from Fed Chair Jay Powell this week saying, you know, if this goes on too long, it's going to be real damage done in terms of bankruptcies, in terms of unemployment and things. And the real question that's posed right now for Congress is, how long can we wait? Because the Democrats say we got to move right away. Republicans say we have a little time to really measure things to decide whether there should be more fiscal stimulus.
Well, you know, there's an interesting argument on both sides. The Fed chairman is suggesting we will need more fiscal stimulus, but he didn't put a time on it. Democrats say we need it right now because states are in trouble, but most of their budgets don't kick in until the 1st of July. And then the question is, how soon do people need more money? These $1,200 checks have gone out, and the unemployment insurance monies that were added to the extra $600, a lot of people say they don't want to go back to work right away because they're making more money than they would have been. And if you don't go back to work when your company says, then you lose your unemployment benefits and you lose your job. So at this point, maybe we don't need it on an emergency basis, and there is a little time, but it is going to be needed, is the point that Jay Powell's making.
Well, and interesting to me was we saw an initiative from both a Democrat and a Republican this week in Congress to talk about that universal guaranteed income that's been talked about before. At what point does this rolling extension of benefits turn into the effectively a UGI for at least people who are at the lower end of the scale?
Well, that's going to be an interesting debate going forward. And the whole thing is going to be interesting, David, how this plays out in society, because it does bring up the idea of inequality and how bad that's gotten and how the people at the lower end of the income scale have been left behind. Is it enough to culturally change the view here in the United States that the government should do less and people should depend on their own individual initiative? That's going to be a hard sell. There is a case to be made for helping the least fortunate and helping those who can't necessarily help themselves. This is nobody's fault, getting laid off because of the virus. But there is a big sort of weight, history and institutional, against doing something like that. So I'm not sure it goes very far once this virus starts to taper off, unless we have another round and we have to close down again and things look really bad.
Well, and that's something Dr. Fauci warned about this week, that we could do more harm than good to the economy if we come back too soon. At the same time, I don't need to remind you, this happens to be an election year for president.
Yeah.
And at some point, you pay attention to the numbers such as Jay Powell put out there, that 40% of people making less than $40,000 are out of work. At some point, that's got to affect the polls come November.
Well, you'd think so. You'd think it might already. Certainly the president's been hammered by the Democrats for his response to the virus. And yet you look at, even with all these numbers we just reported today, Donald Trump still gets better marks than Joe Biden for his handling of the economy. It's a go-figure moment when you look at the polls. The president's approval rating is still dismal, but it hasn't really gone down except for the little bump it had up, and it fell back to its kind of average of about 43%. So does it really matter, or is this a situation where most people have made up their minds one way or another about Donald Trump, and the progress of the disease and the economy isn't going to change a whole lot of people's minds?
But the virus does get a vote. That's pretty clear. And even now, as we wait for President Donald Trump to come out to the Rose Garden and talk about developing a vaccine, he's putting a lot of hope in the possibility of a treatment or a vaccine. He's been talking about this a lot. We haven't seen it yet, but a lot of things could change between now and November.
Yeah, that's the interesting thing about this whole thing is neither Joe Biden nor Donald Trump is really in control of the situation. It is up to the virus and up to the pharmaceutical companies and biotech companies that are working so hard to get not just a vaccine, but to get a treatment. I think people would be willing to go out and risk getting the virus if they knew there was a medicine they could take that would keep them from dying and make them feel better. So either one of those paths would be a game changer in terms of the public's confidence in the economy and its willingness to go back out again. Then the question is, to whom, if either side, do they give credit? Or is it just they like the biotech companies and the pharmaceuticals?
Yeah, indeed. Okay, thank you so much, Mike. It's always great to have you with us. That's Michael McKee from Bloomberg. In the meantime, we are still waiting for President Donald Trump to come out and talk about development of a possible vaccine, and we'll bring that to you when it comes live. This is Balance of Power on Bloomberg Television and on radio. Welcome back to Balance of Power on Bloomberg Television and Radio. I'm David Westin. It is time now for Bloomberg First Word News, and for that we go to Mark Crumpton.
David, thank you. House Speaker Nancy Pelosi is going ahead with a vote today on a virus relief bill that has no chance of being signed into law. Only Democrats are backing the $3 trillion measure. Speaker Pelosi is counting on getting public support for some parts of the bill, such as aid to states and extending unemployment benefits. That could force Senate Republicans into to having to negotiate another round of stimulus. New York's Governor Andrew Cuomo has given the green light for 5 of the state's 10 regions to start reopening today. New York City is not one of them. It has not met the 7 health-related benchmarks to start lifting restrictions. Italy is taking steps to ease restrictions after more than 2 months of a stringent lockdown. According to a statement seen by Bloomberg, Italy will allow citizens to move freely between its 20 regions starting June 3rd. Retail stores and other businesses will reopen on May 18th. African nations are rallying to the defense of World Health Organization Director General Dr. Tedros Ghebreyesus after the body and its leader were criticized by the U.S. for its handling of the coronavirus outbreak. The African group of ambassadors in Geneva is also echoing calls by German Chancellor Angela Merkel to avoid scapegoating over the virus. President Trump has withheld funding from the WHO. He's accused it of mishandling the initial stages of the outbreak. Global news 24 hours a day, on air and on Quick Take by Bloomberg, powered by more than 2,700 journalists and analysts in over 120 countries. I'm Mark Crumpton. This is Bloomberg. David?
Thanks so much, Mark. Well, earlier today, the OPEC Secretary General Mohammed Barkindo spoke with our colleagues Vonnie Quinn and Anne-Marie Hordern about the state of the global oil economy.
So far, we are now focused on the full and timely implementation of the 9.7 that was signed off by participating countries. But also, importantly, to take note, is that some of our countries, like the Kingdom of Saudi Arabia, Kuwait, and the United Arab Emirates, have come forward with additional voluntary supply adjustments in the region of about 1.2 million barrels a day. And this is also on top of the baseline, the effective baseline that they were coming down from, would mean in April, which in total, just these 3 countries, they had effectively reduced production by about 2.74 million barrels a day. So bringing in sum total at the moment, a cumulative 13.64 million barrels a day for the OPEC plus. Now, if you take into account the involuntary shut-ins as well as the voluntary shut-ins globally that we are closely monitoring, the numbers are evolving. At the moment, our numbers show that there is an effective shut-in of about 3.6 million barrels a day globally, including in the United States, bringing the global total to about 17.24 million barrels a day. So far, so good. We are closely monitoring these developments, and the conference in June will look at all this data and all the scenarios and options depending on the demand outlook going out to the second half of the year and the recovery plans of the global community as we navigate ourselves out of this horrific pandemic.
So, Mr. Barkindo, as you look around the world at the shut-ins and at the demand picture, is it your contention that perhaps the worst of the demand destruction has now passed, or are we still going to see more demand destruction?
There is no question at the moment, although here at OPEC we remain cautiously optimistic that the worst is behind us. What we saw in April was extraordinary, and you saw how our member countries, together with our allies in the Declaration of Cooperation, rose to the challenge under the able leadership of the Kingdom of Saudi Arabia and the Russian Federation and all other countries to confront this double whammy of a demand shock of unprecedented proportions, as well as a supply shock in the midst of a pandemic when more than half of the global population is in one form of lockdown or another, bringing the entire global economy literally to a standstill.
What is your base case right now, though, given what you can see visibility-wise for the second half in terms of those cuts? Will you be able to taper? Will OPEC plus countries begin to, ramp up production ever so slightly or taper off those cuts?
There is a growing consensus that the global economy will begin to rebound in the second half. It is the form and shape of the recovery that is in contention. But be that as it may, we will look at all options when we meet in June, depending on the impact of this virus, as well as the impact of the recovery plans, as well as the outlook for demand going into the second half of the year.
That was Mohammed Burkindo. He is the Secretary General of OPEC, speaking to Bloomberg earlier today. We have some news now that's important to those of us who live in the northeastern part of the United States. Andrew Cuomo, the governor of New York, has announced that New York, New Jersey, Delaware, Connecticut beaches will open by Memorial Day. We heard from the governor of New Jersey yesterday, Mr. Murphy, saying they would open them in New Jersey, but now it's expanded out. It will include Connecticut and New York as well as Delaware. Big news here. In the meantime, we'll continue to watch carefully as President Trump says he's about to come out in the Rose Garden and talk about developing a vaccine. We'll bring you that live when it happens. This is Balance of Power on Bloomberg Television and on radio. Welcome back to Bloomberg Balance of Power for television and for radio. I'm David Westin. It's time now to figure out what's going on in the markets, which have been a little bit all over the place. They were well down, but they came back up, still off a little bit. Abigail, what's going on? Given the nature of the economic data, I'm surprised they aren't worse.
That's an interesting point, David, because we, of course, did have that horrible retail sales number this morning, a record low, absolutely plunging for the month of April. And initially, we did see futures react. Earlier today, the S&P 500 had been down more than 1% and then flat right now, down about 0.3%. So the whipsaws that we've been seeing all week continuing. Yesterday, we had a similar reaction around another horrible jobless claims report where stocks initially reacted to the downside. One of the first times we've seen sort of a reality check between data and stocks, but at the end of the day, a big rally. So at this point, it seems as though some of this week's volatility may have to do with options expiration. You see a lot of choppiness around that. Interesting is the weakness, though, that we do have for some of sectors within tech, especially chips, down about 3%. And earlier today, there was some chatter about Huawei and that there could be some sort of a new Huawei rule that would put America first and American companies first. Whether or not that's true, I don't know, but it does seem to be weighing on that sector for sure and making it less risk off than the declines would seem for stocks overall. David, we of course have bonds lower as well, and the Haven yen is about flat. So it's sort of this interesting tug of war still between the bulls and the bears within that range for the S&P 500. On the week, we are down about 3%, David. That would be the worst week going all the way back to that awful week back in March. When the stock market was down about 15%. So nothing in comparison, but a little bit of a win for the bears within the range, David.
Okay, thank you so much to Abigail Abdullah for that report on the markets. And now we want to bring in the person who heads up our healthcare coverage here is Drew Armstrong, because we are still waiting for the president to come out and talk about efforts to develop a vaccine. So Drew, do we have any sense of what we're going to hear from the president today?
Yeah, this looks like one of the formal introductions of the Operation Warp Speed, which is something that we broke news on several weeks ago, and we've seen pieces of news trickle out about. It's a consolidated effort by the White House and the Trump administration to try and accelerate the development and manufacture of a coronavirus vaccine down to a period of months instead of the typical years that it can take to get one of these inoculations out into the market. We're expecting Trump to introduce the ostensible leaders of that effort, a U.S. Army general who heads up the Materiel Command for the Army. Essentially, that's the logistics and supply chain side of the Army, and a former GlaxoSmithKline executive who has been critical in their vaccine development efforts.
And goodness knows, Drew, we're all rooting for them. We want this as fast as we could possibly have it. But is that realistic given the way you develop vaccines, the way you test them and things? Can you speed it up as a practical matter by bringing a lot of people together in a room?
Yeah, I think there's certainly areas where you can speed things up, but I think it's important to remember that all of this is dependent on the science working. In addition to the science risk that you have, there's a lot of development and manufacturing aspects of this that can be sped up if you're willing to spend the money, take on the risk, and assume that some of the waste is going to happen. You can, if you have 5 to 10 or 3, let's say, promising vaccine candidates, start producing them en masse before you know if they work. The reality is that they may not, and if they don't, you're going to have to throw them away. They're going to be wasted money and supplies that you could have been spending elsewhere. But there are things like that you can compress instead of saying, let's identify a vaccine candidate, let's do one test, let's do a wider test, and then only after that a final test, and then only after that begin scaling up manufacturing, and then only after that begin really mass producing the thing. You can compress those things, but it does come at a substantial cost to do so.
Drew, goodness knows we're not the only ones trying to do this. Everyone in the world right now is trying to find a vaccine for the coronavirus. China particularly is really ramped up. Is this turning into sort of an arms race between us and China, or a space race, perhaps using that analogy?
I think that there are certainly a lot of questions about it. I think what's the phrase being tossed around is vaccine nationalism. And there are some competitive aspects to this as well. Certainly, if you have people in your population and your economy inoculated and with a degree of immunity to this virus, it's far easier for you to open up business, trade, education, all of the things that we want to do and get back to normal with under those circumstances. So there is a competitive aspect to this. I would also say that, it is beneficial to have the rest of the world safe as well, not only because they are our important trading partners, but also it means that you have fewer risks about people re-importing the disease back into your country. So there is a benefit to this being a global effort, both from a health perspective and from an economic perspective.
Well, we'll take any benefits we can get right now in developing a vaccine, no question about it. Thank you so much to Drew Armstrong, who, as I say, heads up our healthcare coverage here at Bloomberg. To repeat, we are waiting right now for President Donald Trump to come out in the Rose Garden at the White House, where he's going to talk about this initiative to find a vaccine, that project I think they call Warp Speed, where he's putting together a group of people, private and public, to try to get a vaccine as fast as possible. And in the meantime, when we come back, we're going to be talking with the CEO of the largest Medicaid provider in the country, that's Centene. We're going to talk about exactly how the plight of Americans has been affected by this pandemic. That's coming up next on Balance of Power on Bloomberg Television and on radio. Welcome back to Balance of Power on Bloomberg Television and radio. I'm David Westin. Well, the response to the pandemic has put some 36 million Americans out of work in just the last 8 weeks or so. And one company that has a unique position to really judge what's going on is Centene. It actually is the largest Medicaid provider in the country, and believe it or not, it helps 1 out of 15 Americans with their health care. So we welcome now the CEO of Centene, and he is Mr. Michael Neidorff. So, Mr. Neidorff, thank you so much for being with us. Give us a sense, because you do have Medicaid, Medicare, a lot of the people we talk about that seem to be the most vulnerable to this disease. Give us a sense of the disease from their point of view, because you see it day in and day out.
Yes, thank you, and it's a pleasure to be here. We deal with some of the most vulnerable populations, and some of it is just the density in which they live in the urban areas. That's a contributory factor. The individuals we cover on Medicaid and long-term care and others tend to have high-quality care and access to it. So we're focused on those that don't and see what we can do to help them. But it's really this is something the world's never faced before. I mean, I tell people experience is the sum of experiences. And there's not enough experience in this except to learn as we go. We are growing significantly. We talk about, unfortunately, this unemployment. We've added over 1,000 people to our employment rolls over the last 5-6 weeks because of the expansion of the business. But it's very difficult, and we're learning as we go.
Is that mainly in the area of Medicaid patients that you're adding because of unemployment?
Yes, we are adding significant Medicaid. We anticipate that. We have some studies done. We'll add some to the long-term care. Of course, Medicare we won't be adding except during the open enrollment periods. But that's really That's really where it's at, is in the Medicaid.
And what about the demand for services? What have you seen? Because an awful lot of the elective surgeries and things like that have been put off. So what do you see in terms of what the health care being provided has done?
So the discretionary care has fallen off. And I expect we'll see that as we get our numbers out, that April was probably the lowest utilization we've ever seen. Emergency room, which a lot of our population is used from time to time, has fallen off. The only part of our business, we have a lot of babies born in our population, and that part, that hasn't fallen off. That comes when it's ready. So, but the inpatient use, the outpatient services has fallen off. I expect to see it start to pick up the end of this month and the beginning of June. Hospitals are doing what they can to start to be able to bring that business back in for their own reasons, as well as the need of the patients.
A fair amount of your business must be from reimbursements from states on Medicaid, things like that. Are you concerned at all? We hear that the states, some of them are in really bad shape. Could that put some pressure on your reimbursements?
Well, there's always that risk of pressure on the reimbursement, but there's federal law that says the rates have to be actuarially sound. And the federal government in the first go-through has increased what they call the FMAP, is where they contribute the amount that they contribute in matching funds to the state for Medicaid, and they increased it by 6%, and now they're talking about increasing it further to 12 or 14%. So the federal government's recognizing the pressure that the states are under in this area and providing some funds. And so I think the big issue here is, the states might say, well, look, you had less utilization in Q2, but we're helping them to understand this is going to come back in Q3 and Q4, hopefully. We hope the pandemic eases to the point that starts to come back. So it's a matter of timing. We talk about choppiness. And the utilization's there, the medical needs are there, and I think it will come back. But the states and their population, we're working with them. We understand it. And I think they understand that we bring value. In fact, I have told some states that if they want to save money where they haven't done the long-term care and some other high acuity cases, we can save them a lot of money in that and have demonstrated with higher quality.
I was going to ask you about the choppiness that, as you've described it, because you had a strong first quarter. For the year, you basically have kept with your guidance, which is pretty unusual these days. A lot of companies have just walked away from guidance altogether. So you're saying you think over the course of the entire year, you'll make up whatever you might lose in the second quarter. What are you looking for in 2021?
Well, that's you really are asking the question we think about a lot, because the baseline that we're going to have as we compare quarter to quarter for 2021 off 20, presuming we're able to resolve a lot of the COVID issues, will be very difficult. I think on this year we've held that guidance. We think there could be some improvement in the earnings. That's yet to be seen, and we prefer just to leave it there as a basis for as it swings from quarter to quarter. But I think next year, if things come under more control and we do find vaccines and medicine secured, I think we'll fall back to a more normalized quarter with growth. I mean, we're growing significantly because of the unemployment, but that's not the way we want to grow. We're able to grow just by providing expanded services, and I'm not proud of the fact we're growing because of increased unemployment. It's an unfortunate consequence of it, but we're going to grow in 21, I believe, if things settle down the normal way through expanded services.
So, Michael, we may interrupt you at some point because President Trump is supposed to be coming out to the Rose Garden to talk about vaccines. We want to get as much out of you as you can while we have you. Give us a sense longer term. You have been CEO since, I think, 1996 of Centene. You've built this company really with your team from a relatively modest company into a huge company. What do you think the longer term effects may be on healthcare in this country from this pandemic?
Well, I think it's going to change. I was thinking about that a lot recently. And when we first came to town and we had young children, there was a children's clinic, and they had two entrances for sick children and for well children. And I was thinking we may start to see more of that, where individuals are going to hospitals to provide other providers. We're going to have to see some bifurcation, in my opinion. When somebody needs a doctor and it's normal care, they're going to have to go in one way and see a group. And then if somebody has a suspected disease of some kind, they're going to go in another way. I think we're going to see these services bifurcated. I think we're going to see more in the terms of we're working to develop our specific needs on telemedicine because there's a lack of primary care. So I think we're going to be finding ways to deliver things more efficiently, and we're going to have to. And we're going to have to ensure that reinvest in what we used to do and try and identify where a pandemic might surface and be prepared for it. I think we're going to start to see strategic reserves in PPE. We have it in oil. We have it in weapons. We should have it in PPE. I think we're going to see an expansion of that. And so we're going to see managed care playing a bigger role because we are providing access and we are ensuring that care is efficient.
Okay, Michael, I really appreciate you spending time with us today. It was fascinating. That's Michael Neidorff. He is the CEO of Centene. And now it's time for First Word News, and we go to Mark Crumpton for that.
David, thank you. The Food and Drug Administration is giving new guidance to the White House about how often President Trump and others should be tested for COVID-19. This after data suggested that a rapid test made by Abbott Labs and used by the president and others every day may provide inaccuracies and false negatives. The FDA says if someone is suspected of having the virus and the first test is negative, a second test might be worthwhile. New York City will remain on lockdown for at least 2 more weeks. The city and other nearby regions, including Long Island, did not meet requirements for reopening. Governor Andrew Cuomo says 5 upstate regions can reopen. The metrics used to determine readiness include requirements for hospital bed capacity, testing, and tracing. The UK says there's been very limited progress toward a post-Brexit deal. Britain's chief negotiator, David Frost, blames what he calls the European Union's novel and unbalanced proposals. He also criticized EU demands for access to UK fishing waters. Only one round of talks remains. Next month, politicians meet to decide the way forward. Global news 24 hours a day, on air and on Quick Take by Bloomberg, powered by more than 2,700 journalists and analysts in over 120 countries. I'm Mark Crumpton. This is Bloomberg. David?
Thanks so much, Mark. We continue to wait for the President of the United States to come out in the Rose Garden and address the question of vaccine development. This is Balance of Power on Bloomberg Television and Radio.
Starting to resume their American way of life. We will be reigniting our economic engines. We're going to be taking care of our most vulnerable, which are our senior citizens and some others. We're going to be working very, very hard on our senior citizens and our nursing homes and various communities to support those that are struggling in this very difficult time. Others don't have the same kind of struggle. For example, today, Secretary Perdue, together with Ivanka Trump, launched the Farmers and Families Food Box program, which will provide $3 billion to help small farmers. And it'll be helping farmers, ranchers, but it'll be bringing food to some of the food lines and some of the food kitchens that you've been seeing on television. And I said, why aren't we doing that? We have all of this tremendous food produced by our farmers and our ranchers. And so we're going to be buying $3 billion worth of that food. Great for everybody, our farmers, our ranchers, and the people that need great food. A key feature of our reopening plan is the largest and most ambitious testing system in the world, by far. America is now conducting close to 350,000 tests per day, an unthinkable number just a short while ago. More than anybody in the world by far, suggesting many states now have excess testing capacity to monitor for new outbreaks. Florida, many other states have so much testing, the testers are waiting for people to show up. It's great. Another essential pillar of our strategy to keep America open is the development of effective treatments and vaccines as quickly as possible. I want to see if we can do that very quickly. We're looking to When I say quickly, we're looking to get it by the end of the year if we can, maybe before. We're doing tremendously well. From the earliest days of the pandemic, we have marshaled the genius of American scientists and researchers from all across government and the private sector, from academia, from everywhere to vanquish the virus, and tremendous strides have been made. I can tell you, I get to see it every day. Tremendous strides are being made. Scientists at the NIH began developing the first vaccine candidate on January 11th. Think of that. Within hours of the virus's genetic code being posted online. So January 11th, most people never even heard what was going on January 11th, and we were out there trying to develop a vaccine, not even knowing what we were up against. Then my administration cut through every piece of red tape to achieve the fastest ever by far launch of a vaccine trial for this new virus, this very vicious virus. And I want to thank all of the doctors and scientists and researchers involved, because they've never moved like this, or never even close. The NIH and the HHS have also been working constantly with private industry to evaluate more than 100 potential treatments. The Food and Drug Administration has swiftly approved more than 130 therapies for active trials. That's what we have right now, 130. And another 450 are in the planning stages, and tremendous potential awaits. I think we're going to have some very interesting things to report in the not-too-distant future. And thank you very much to Dr. Hahn. Through a historic series of funding bills, my administration is providing roughly $10 billion to support a medical research effort without parallel. I especially want to thank Senator Steve Daines of Montana for his incredible work. He has worked so hard to secure additional funding for vaccine development. He has been right at the forefront. Today, I want to update you on the next stage of this momentous medical initiative. It's called Operation Warp Speed. That means big and it means fast, a massive scientific, industrial, and logistical endeavor unlike anything our country has seen since the Manhattan Project. You really could say that nobody's seen anything like we're doing, whether it's ventilators or testing. Nobody's seen anything like we're doing now within our country since the Second World War. Incredible. Its objective is to finish developing and then to manufacture and distribute a proven coronavirus vaccine as fast as possible. Again, we'd love to see if we could do it prior to the end of the year. We think we're going to have some very good results coming out very quickly. In addition, it will continue accelerating the development of diagnostics and breakthrough therapies. The great national project will bring together the best of American industry and innovation, the full resources of the United States government, and the excellence and precision of the United States military. We have the military totally involved. We're also working very strongly with other countries who are also have some great scientists, doctors, and we're all working very closely together, and they're viewing us as the leader, and we are the relationship with other countries on solving this problem has been incredible. To date, Operation Warp Speed has brought together all of the experts across the federal government from places like the NIH, CDC, FDA, and many other agencies. This historic partnership will now bring together the full resources of the Department of Health and Human Services with the Department of Defense, and we know what that means. That means the full power and strength of the military, and that really talking about the logistics. We get it when we get it. That means the logistics, getting it out so that everybody can take it. And today we're proud to announce the addition of two of the most highly respected, skilled professionals in our country, worldwide respected. Operation Warp Speed's chief scientist will be Dr. Moncef Slaoui, a world-renowned immunologist who helped create 14 new vaccines. That's a lot of our new vaccines in 10 years during his time in the private sector, one of the most respected men in the world in the production and really on the formulation of vaccines. Joining Dr. Slowey as Chief Operating Officer will be General Gus Perna, a four-star general who currently oversees 190,000 service members, civilians, and contractors as commander of the U.S. Army Material Command. That means logistics. That means getting it out. We got to get it out there. So, General, thank you very much. And Doctor, thank you very much. It's great to have you on board. Really highly respected people. Thank you. These two outstanding individuals will provide more details following my remarks. In preparation for this initiative, experts throughout the government have been collaborating to evaluate roughly 100 vaccine candidates from all over the world. They have identified 14 that they believe are the most promising, and they're working to narrow that list still further. So we started off with over 100. We're down to 14, and we have some really interesting choices to be made. They're doing very well. Through Operation Warp Speed, the federal government is providing unprecedented support and resources to safely expedite the trials, moving on at record speed. While we accelerate the final phases of vaccine trials, Operation Warp Speed will be simultaneously accelerating its manufacturing process. In other words, we're getting ready so that when we get the good word that we have the vaccine, we have the formula, we have what we need, we're ready to go, as opposed to taking years to gear up. We're gearing up. It's risky, it's expensive, but we'll be saving massive amounts of time. We'll be saving years if we do this properly, and that's what we're doing. So we're gearing up on the assumption that we'll have in the near future, relatively near future, a vaccine. Typically, pharmaceutical companies wait to manufacture a vaccine until it has received all of the regulatory approvals necessary, and this can delay vaccines availability to the public as much as a year and even more than that. However, our task is so urgent that under Operation Warp Speed, the federal government will invest in manufacturing all of the top vaccine candidates before they're approved. So we're knowing exactly what we're doing before they're approved. That means they better come up with a good vaccine because we're ready to deliver it. This will eliminate any unnecessary delay and enable us to begin providing Americans with a proven vaccine the day our scientists say, we're ready, we got it. And as we work to bring critical medical production back to America, these vaccines will manufacture that we're going to be focused on and manufacturing. They're all going to be right here in the USA. Now, we're working, as I said, with other people outside, and that's fine, too. We want to get to the solution. We know exactly where the other countries are, and we'll be very happy if they were able to do it. We'll help them with delivery. We'll help them with in every way we can. We have no ego when it comes to this, no ego whatsoever. Operation Warp Speed is also making the necessary preparations to distribute these life-saving treatments at scale. So we're talking about massive numbers so that millions of Americans will quickly have access to them. This includes ramping up production of supplies needed for distribution. And I have to say, we're also very, very much involved in other things other than the vaccine. If you take a look at what we're doing beyond vaccines, it's going to be very interesting, and we may talk about that in a little while. But this includes ramping up production of supplies needed for distribution, such as cold chain storage, glass vials, needles, syringes, and more. We'll have everything right on hand, ready to go. When a vaccine is ready, the U.S. government will deploy every plane, truck, and soldier required to help distribute it to the American people as quickly as possible. America is blessed to have the most brilliant, talented doctors and researchers anywhere in the world. We have the mightiest military by far in the world. Our military is completely rebuilt. Much of the equipment has been delivered. Some of it's on the way, all made right here in the USA. We took over very, very empty cupboards, I say medically. We also had empty cupboards in a military sense. Our military was in sad shape. It was depleted. we now have the strongest military the United States has ever had by far and the best equipment. And you hear that outside, that beautiful sound. Those are truckers that are with us all the way. They're protesting in favor of President Trump as opposed to against. There's hundreds of trucks out there. And that's the sign of love, not the sign of your typical protest. So I want to thank our great truckers. They like me and I like them. We're working on something together. But we have the mightiest, and they'll be helping us with this, by the way, speaking of truckers. We have the mightiest military in the long history of humankind. We have the best and most devoted workers ever to walk the face of the earth. And now we're combining all of these amazing strengths for the most aggressive vaccine project in history. There's never been a vaccine project anywhere in history like this. And I just want to make something clear. It's very important. Vaccine or no vaccine, we're back. And we're starting the process. And in many cases, they don't have vaccines. And a virus or a flu comes, and you fight through it. We haven't seen anything like this in 100 and some odd years, 1917. But you fight through it, and people sometimes, I guess, we don't know exactly yet, but it looks like they become immune, or at least for a short while and maybe for life. But you fight through it. But what we'd like to do, if we can, is the vaccine. I think we're going to be successful in doing it, and hopefully by the end of the year. Just as generations of Americans before us faced down the most difficult trials, set their sights on the highest summit, and overcame the biggest obstacles, America will meet the moment, and this moment specifically in our time, with unrivaled speed, unmatched skill, and the unyielding spirit of the American people. Our nation will come back stronger and greater than ever. We're going to have a tremendous year next year. We're going to have a really good fourth quarter. We're going to have a very interesting and productive transition quarter where Steve is there, and I'm sure our Secretary of the Treasury, I think you feel the same way, Steve. So, and thank you for your good work, really good work. And it's not finished yet, is it? I want to thank Steve Mnuchin, everybody. Now I'd like to ask...
We have been listening to President Donald Trump speaking from the Rose Garden at the White House as he announced the leadership for what he calls Operation Warp Speed. That is the private-public partnership to develop a vaccine as fast as possible. It includes a chief scientist from GlaxoSmithKline and a U.S. Army general. You can continue to watch this on Live Go on your terminal. That does it for Balance of Power, and this is Bloomberg.